Hello. Hi, I'm Joan. Good to have you all join me today. I've started a little early, so I hope you can all hear me. Hello. I think I started a little too early there. Anyway, hi. Good to have you join me today. I'm Joan Ashcroft from Ashcroft Medical English, and it's wonderful to have you here today. So we're here today for a free class on OET writing so that you can feel a little bit more comfortable about picking the right content for your letter. But before we get started, it would be amazing if you could add into the comments where you're from and what your occupation is. So it's always good to know who's joining me. So are you a doctor, a nurse, dentist, vet? It would be great to know. So if you could pop your answers in the comments, that would be excellent. Okay. I'm just going to briefly introduce myself while you do that, okay? I'm just going to share my screen with you just now. Okay, so today's session then is all about confidently picking the perfect content for OET writing. Now, this topic's been chosen because it is something that is a bit of a challenge for a number of students. So I thought I would help you out with that today. So, as I said, for those who don't know me, I'm Joan. I'm Joan Ashcroft. I'm a former UK doctor, and I'm here to just help you out, reach your goals, pass OET, get the jobs that you're dreaming of, and yeah, just to take your next step in your career. Um, so. Um, what I do as an OET teacher is provide regular classes on social media. I've been doing that as an all star for the past year and will continue to do so on my own social media channels. So if you would like to keep up with tips, free classes, things like that, then you can join me on my channels. Um, so, as a premium preparation provider, what you can be assured of is that I've had high level training for OET teaching, and the courses that you would get with me are of high standard. Please excuse me if my voice sounds a little weird today. I've got a bit of a cold, so yes, please excuse the strange sounding voice. Anyway, moving on. If you do want to consider having a bit of help along the way, and many students really do need this, particularly for OET writing and speaking, is what I'm finding. But for all four subtests, it could be that you need a little bit of help. Then I would strongly advise having, some lessons to get a bit of guidance and shortcut this process of getting where you need to be. Anyway, if you are interested in that, you can have a trial lesson with me and you'll get 50% off your trial lesson. So you'll get details of that at the end. What you can do if you have classes with me is choose from three different options. So there's lesson packages, which reduce the cost, single classes, and you can even get some offline writing feedback, which can be really handy. Anyway, enough about me. You'll get details on the trial lesson offer at the end of class. I'm going to have a little look at who's joining me today. I can see that a few of you are joining me from various places across the world, including the UK. So I can see that we have nurses, we have doctors. Yeah, so thank you so much for joining me. I hope you get a lot out of today's session. So, what are we going to cover today? Well, first of all, we're going to really look at why choosing the right content is so important. We're going to analyze carefully exactly what that right content is. and we're going to help you feel confident about your choices. So, why is choosing the right content so important? So, what do you think, guys? Why do you think it's so important to select the right content? Answers in the comments if you don't mind. Okay, so here are a few things to think about. The most obvious, right? You want to pass OET writing. Unfortunately, if there are major errors with content, the score will end up low. And you don't want to fail OET writing because of the content choice. And over and above that, once you do pass OET, you'll be going into work. And here you'll want to be making sure that you communicate effectively in your writing because written communication is going to be part of your everyday life. So now we're clear on the importance of it. Let's see how it fits into the writing criteria. So, for those who are not aware yet, there are six test criteria for OET writing, and they cover purpose, content, conciseness and clarity, organization and layout, genre and style, and language. Okay, what we're focusing on mainly is content. If you're not familiar with the test criteria, what you can do is find these criteria on OET.com, and you'll be able to download a copy of the test criteria. Now, what you'll see is something similar to this, and as I said, we're focusing in on content. Now, as you can see, the score runs from 0 through to 7. And obviously, you're wanting to aim high, okay? The maximum score is 7. So, if you are getting a score that is as high as 7, then your content is going to be appropriate to the intended reader and is going to address what they need to continue care. So you're not going to be missing out key information, and the important details aren't missing, and you will be representing the case notes accurately. So that's another important point, just to make sure that as you put the case notes into your own words, that those words still say the same thing. Okay? So let's have a look at the process you'll be going through as candidates as you're trying to pick the right information. So in your mind, you can think to yourself, is this information the reader really wants? And you can ask yourself, does this information allow them to do what I'm asking of them? Then you can check, have I included all of the information the reader needs? And then finally, have I represented this information accurately? So, all in all, what you're trying to do is make sure that all the relevant information is included. There is no irrelevant information so that you produce a letter with great content. No important information missing. The reader can do their job. You're not distracting them with irrelevant details, and your message is crystal clear. So, over to you now. Let's have a think. Imagine you receive a letter at work from another healthcare professional that's actually missing information that you need to do your job. What problems does it cause you? And also, how do you feel when you receive a letter with a lot of irrelevant information? Answers in the comments if you don't mind. How does irrelevant information and missing information impact you at work? Okay, let's see. if your feelings are similar to this. Okay, so you may think to yourself, well, I'm missing the most important information. I need to do my job. You might be confused as to what you're being asked to do. You may end up needing to go back to the writer to ask more questions, or you might just be a little bit irritated and wonder what the point was in them telling you this information. So, obviously, all of these negative responses are not what we're looking for. So, we can avoid them and just pick the right content for the letters. But what is the right content? I hear you ask. Okay, so as we've spoken before, we can ask ourselves some questions. And one of the most important is to be clear on who you're writing to. So the information that you're going to provide is not going to be the same for all healthcare professionals. So you need to be clear on who you're writing to. You need to be clear on why you're writing to them. And you need to think really about what you would want to know if you were them. So think to yourself, what would I want to know? So, in terms of who you're writing to, if you're new to OET writing, um, this is where to look. Okay, you're going to go to the writing task of the test, and you'll see who you're writing to. So you can see that in this case, you're writing to Dr. Banerjee. Now, just for your information, this writing task comes from sample test 5 on the OET website. So if you're wanting to refer to that after class, that's where to go. So so we know who we're writing to. So now let's think about why you're writing. So the reason why you're writing really has two components. We can think of the purpose, as in what you need from the reader, and you can also think about the problem. You know, what's the issue that you're needing help with in terms of the patient's problem, their health condition. So we can find out why we're writing, so the exact thing we're requesting from them in the writing task again. So, can anyone spot in the writing task the exact reason for writing? You know, what it is you're asking for? You can place your answers in the comments once you spot what you're going to be asking the reader for. Okay, hopefully you'll be able to see here that this is what we want from the reader. We want some advice and a review of the patient's medication. So that's what we want from the reader. And then we need to be clear on what the actual problem is with our patient. So our patient's Miss Bennett, and we can find out what the problem is by having a look at the notes. So this will be at the beginning of the writing test, okay? And you'll be able to see what the actual issue is. So you can pop your answer in the comments. What's the problem that our patient is having? Okay, so I'm sure you've all spotted that there, that we can see that the patient has cardiac problems. We can also find more details regarding the patient's problem, obviously throughout the case note. So you can see that it gets expanded upon throughout the case notes, and we can see that the patient has unfortunately suffered from a heart attack. So, with that in mind, now we can start to think about what you would want to know if you were the cardiologist receiving this referral letter. Okay, so to sum up, you are the cardiologist now. Imagine you're the cardiologist, okay? We're going to put ourselves into the shoes of the reader. So you're the cardiologist now. You're receiving a letter about a patient with cardiac problems. She's had a recent MI. You're being requested to give advice and a medication review. What would you want to know? Okay, so have a think about that for a moment, and then we'll move on to having a look at the case notes and selecting the sort of information that the cardiologist will really be interested in. Okay, what we're trying to do as we go through the case notes is to be clear on what is relevant and what is irrelevant. So, relevant or irrelevant. These are the patient's case notes. Okay, so this is Miss Bennett's case notes. And we're going to imagine now that you're the cardiologist reading a letter. Which pieces of information in the social background would you be interested in? So we're trying to pick out relevant information. Thank you, Mohammed. I can see in your comments you've got some useful suggestions. You're going to be interested in risk factors, age, etc., current medications. Very good. So, first of all, we'll just have a look at the social background and the family history. And you can imagine you're taking the test and you're trying to scan now for relevant information. If you're on the computer, you would be able to highlight the relevant information after your 5 minutes reading time. Once you've highlighted the text, you might have something that looks perhaps a little bit like this. Okay, so you might think that yes, she has a stressful job, that could be relevant. There's other stressors in her life that are mentioned. We can see some of her risk factors here, and we can also see that there is a family history of heart disease, for example. We can see some things that could be relevant, but we're going to need to make sure that we're concise when we put this information into the letter. So now let's have a look then at the sample letter. So this is the main body of the sample letter that corresponds to the test that we're looking at right now. And we can see how they've used this information and put it into the letter. So yes, they have highlighted the patient's age. They've mentioned her occupation, but do you see how they've made it much more concise? They've mentioned some of the risk factors here in a more concise way. And they've also included family history and the issues regarding the family situation. Okay, so as you can see, the words from the case notes have been transformed into other words. It's been paraphrased and made more concise. Okay, so this is an example of what you can do with the information in the case notes. So far we've just focused on social history and family history. Now we're going to move on to looking at more relevant information. Okay, so tell me, relevant or irrelevant? We're looking at the case notes and the medication and treatments that the patient has been given on discharge. What do you think? Should we include this or not? Relevant or irrelevant? Okay, so we can see that in the case notes, what we're really looking at is the patient's medication, that she's going to be referred for cardiac rehab. Sorry, that she was referred but didn't attend, and lifestyle advice. So, would you consider this to be important information to share with a cardiologist? Yeah, I think. You would agree, yeah, it's really important for the cardiologist to be aware of this. So this is definitely going to go into the letter, and we can see how this information has been included. We can see the medications here, the lifestyle changes mentioned, and the fact that she was referred for cardiac rehabilitation but did not attend. Excellent. So we can see that sometimes it's quite clear that the information is relevant, and sometimes it's a little bit more tricky to decide. Okay, what I would suggest that you do as a follow on exercise is to go to sample test 5 on the OET website, continue reading through the case notes, select the relevant information, and try writing your own letter. Then what I would do is I would compare your letter to the sample letter. Try and notice where your content choices have been similar to the sample letter and where they have been different. And just have a look at how you've summarized the information compared to how the information has been summarized in the sample letter. Now, remember that the sample letter is just one way you can write the letter. It's not the only way, so some variations are acceptable. So that's something you can try at home. Now, in terms of knowing if you're on the right track, sometimes it can be really useful to get a little bit of feedback on your writing. So, if that's something that you think you need, and I would recommend it, is really just book some feedback, and that can be with myself or any other teacher you wish. But I would highly recommend that you do get feedback, and you can get that through Ashcroft Medical English if you wish. Okay. So, here are some common mistakes that are made, and I would like you to avoid them if at all possible because I really want you to do well in OET writing. So, when you have read through the case notes at that point and when your writing time commences, you are allowed to then put pen to paper or, you know, the equivalent on the computer, and you can start highlighting or underlining the relevant content. Now, please make sure that you do this because not highlighting or underlining the relevant content means you're probably going to miss something. Okay, you'll forget to include it. And we don't want you to leave out key information. Okay. So the other mistake, which we've already touched on earlier, is not really thinking about what the reader needs. So you need to really be careful about who you're writing to and imagine what they need. As I say, the reader's going to vary. So you need to adjust the content according to the reader. Remember, don't distract the reader with irrelevant content. They might start getting a bit confused if the content is not concise and clear. Okay, and it's also important that when you do put that information in, that that when you paraphrase it, the meaning hasn't completely changed. Okay, so be careful to read back how you've paraphrased it so that the information is actually accurate still. Okay, so well, I think we've covered quite a lot there today. As I've said, if you do feel that you need some help, you know where you can find me. There's some details in the YouTube bio, so you can see the link. But it's basically just ashcroftmedicalenglish.com. You can get a trial lesson with me if you wish, and that the price of that is reduced by 50% of the standard price for lessons. So if you want a little bit of help with reading feedback, if you want to even practice a little bit with your speaking role plays, or you're just struggling with your listening or reading, I'm here for you to help you out with that. Okay. Um, so please feel free to book. this is where you can find me. So before we wrap up today, I can see that there's a little question from one of you in the comments here, and I'd like to answer that. So Mohammed, you were asking about the dosage. So BID, TID, once daily, all of this. So in regards to drug dosages, think about whether or not the reader wants to know. So, what do you think? So, what do you think? Um, would a cardiologist be interested in the dosages of the cardiac medications? If you were a cardiologist, would you want to know those or would you consider it unimportant? What do you think? So, if we think about most specialists, when it comes to, if we're thinking about a doctor who's a specialist in their field, and we are asking them to review medication, I think we would agree that they're going to really want those details, right? So, if you're in particular asking them to review the medication, then yeah, all those details regarding the cardiac medications, including the dosage, will be absolutely essential. Okay, so hopefully, if you just think about it from the reader's point of view, you'll see that they do need it. Okay, so Mohammed, you don't think they would need it because they're standard doses. Well, actually, the doses could vary from patient to patient, and for clarification, it would be better to just put them in so that there can be no doubt about that. So, my advice to you would be to definitely include those doses, okay, just for complete clarity. Okay, complete clarity so that there's no confusion. We don't want any confusion with medication dosages, okay, particularly when it's a medication review. So, hopefully, that helps answer the question. So, okay, we'll have to wrap up for today, but I can see that in the comments that some of you are interested in having a little bit of help. So, if you would like to study with me, then I'm here to help you. Just feel free to go on to the website, Ashcroft Medical English, and yeah, make the most of the discount for the trial lesson. There is limited availability, so I would book when you can. Okay, well, it's been lovely seeing you all here today. Thank you very much for joining me. Today will be the last All Stars session that I will be doing, but you will still be able to see previous All Stars videos with free classes on the OET website, okay? And for any future content that you'd like from me, join me on my social media channels and I'd be happy to help you out. Okay, take care and I hope to see you in class soon.